How's it going, everybody? Welcome to our next episode of the Ride Along. As always, we have an amazing guest lined up, another awesome medical professional, Mr. Dan Snow, who's been working in the medical industry since 1995 when he got his EMT certification. From there, he worked as a paramedic for about 3 to 4 years before becoming a nurse for about 3 to 4 years after that, and he became a nurse anesthetist in 2005, and he has worked in that position since. So he has a really great view of the medical industry as a whole, having worked as a paramedic and now a nurse in the hospital. He's got a lot of interesting insights, and we're really glad he's here. Obviously, with the crazy times we have going on right now, we really appreciate you taking the time out of your day to let us interview you. And we can just
Hey, good afternoon, Jay. Thanks for having me.
No problem. Thank you again. So we can just get started kind of with the first question of what does a nurse anesthetist do? I've watched Grey's Anatomy a little bit, so I think I have a decent view of the medical process. Obviously, maybe not a true view, but can you just kind of go over what you really do in your position on a day-to-day basis and just kind of an overview?
Sure. So in a nutshell, a nurse anesthetist will put a patient to sleep and wake a patient up. And that's the oversimplified version, but to be a little more in-depth, we administer medications, we do patient interviews, we handle emergency airway type management things. We also work on the OB floor where we provide epidural and pain management services to pregnant ladies. We do certain aspects of pain management, or we do injections, and there's quite a variety in the nurse anesthesia field, and it's growing. But day to day, most CRNAs, probably 90 to 90% of CRNAs, their day to day practice, they go to the OR, they take their patient back, and they administer anesthetic medication, keep the patient asleep for a procedure, and then wake the patient up. And that's the simplified version, but like I said, it sounds simple, but a nurse anesthetist knows more than the average nurse, and so it's just you have to be prepared for almost anything. You can have a trauma, and where you have to manage fluid resuscitation, a burn patient, or you have a pediatric patient. Or there's all sorts of scenarios that present. You have that background knowledge to handle each and every one. So it's a little more than putting them to sleep and waking them up, but in a nutshell, that's what we do.
So how did you, 1995, and you're getting your EMT certification, what made you want to go into the medical industry? Had it been something you've been interested in as a kid, or kind of what put you onto that career path?
Sure. Well, to go way back, my grandmother was a nurse in the OR, or my great-grandmother. My grandmother was also a nurse. My mother was a nurse. I got several other people that are in my family that are nursing or healthcare related. And so just as growing up, I was just kind of always empathetic and kind of got started in healthcare. My mom was pushing me toward getting my CPR certification so that we could do CPR classes together. As a summer job, I was a lifeguard. And then from there, once I got into college, I kind of ran into people that were running in the healthcare kind of circle in Tyler, and EMT school was there. And of course, my mom was always pushing me to go to nursing school. And so it just seemed kind of like a natural progression. Of course, I had the empathy for people, you want to help people. And so that was just kind of a natural direction that I think I took. And once I get into school and into some of the programs, you meet people, make connections, and I think you start working in the field and you make more connections, and you toss ideas around about what you want to do and who does what, that sort of thing. And so kind of one thing led to another. It certainly wasn't what I wanted to do when I was in high school, and I didn't wake up and think I want to be a nurse anesthetist.
Right.
As a senior in high school, it was something that kind of presented itself to me after I got to know people and be in healthcare and kind of have my boots on the ground, so to speak.
Gotcha. So why did you start with paramedic route first before getting into nursing?
So it was a buddy, and actually I was in nursing school. This is kind of a long story, but I got into it was an associate's degree nursing program at Tyler Junior College, and it was when I was pretty young. I was probably 20, 21 years old, and I couldn't stand it. after I got in, and I didn't do well in it consequently. And I was probably pretty young and a little immature, and so I decided after the first semester that that was not for me, and I was going to do something else. So I had a buddy; he was in paramedic school, and he was like, "Man, just come do this," you know. So it was exciting, adrenaline. You know, you're riding on the ambulance lights and sirens, and starting IVs and doing all of the fun stuff, and so it's kind of an adrenaline rush, so to speak. And so I did that, enjoyed it, and was good at it. But at the end of the day, you don't make a whole lot of money. So I took another look at nursing school, and I went to the University of Texas at Tyler and got a bachelor's degree
Mhm.
after probably 4 years
Mhm.
in nursing, and began working in the ICU. Um, because I had that background in emergency medicine, the ICU was kind of that next level of progression. And so you could either go you can work in the ER, or you
Mhm.
could work in the ICU. And so I chose the ICU. And my roommate at a time his uncle was a nurse anesthetist, and so he was always kind of steering us toward the nurse anesthetist. You guys need to go to nurse anesthetist school. He kept putting that in our ear. So. Uh, So yeah, and that was in the early 2000s.
Mhm.
That I was a nurse in that. I was a CRN. I mean, I'm sorry, I was a ICU nurse
Mhm.
for 2 3 years, and you have to have that ICU experience in order to apply for anesthesia school.
Mhm.
So after
Yes,
I met that qualification and had some experience, I
gotcha.
applied and was accepted.
So there is a requirement for the amount of time you have to have in the ICU before you're allowed to apply to anesthesia school, or is it just you have to have some time or a specific year maybe or set of years?
Yes, it may differ between, it may be different for different programs, but I
Mhm.
think generally they want you to have 1 to 2 years of ICU experience, and it probably needs to be in an ICU that is fairly busy. I mean, every little hospital may have an ICU, but
Mhm.
you need something that where there's some volume and where you really get some good experience in
Right.
managing critically ill patients. And Tyler had that, and so yeah, it was a great fit.
And so then what is the process of like so you're in the anesthesiology school, anesthesia school. What is that like? How is that different from when you went through nursing, your nursing program and stuff like that? What is the major difference between at that level?
Sure. So nursing school, uh, it wasn't for me. It was a challenge, and
Mhm.
it wasn't. You learn a lot. You learn some good material. I'm not knocking nursing school. It's important and it has its place for sure. Um, I really enjoyed anesthesia school. It was a more focused area of study, and I did better in it than I did in nursing school.
Mhm.
Um, and maybe it was just because of the content, the professors, teaching method. It was they don't want to see you fail. They want to see you succeed,
Right.
and it's geared toward that. But
Mhm.
it wasn't a blow off either by any means. We studied and studied and studied some more, and so. But the information again that you learn is all information you're going to use,
Mhm.
and so that made it more enjoyable. The people that and I had the best time in nurse anesthesia school. Even though I wasn't a star student. I think I made a high 3.4 or something was my GPA when I got out. But the people that are in it are great. You make some great friends and you have a great time. Um, you're treated more as a professional, and so that was the main difference for me. It was more focused area of study, and uh, and so it made it easier from that aspect than nursing school, which is really broad, and
Uh-huh.
um, and so once you get into your upper courses, a lot of them are like that, and that was the experience for a lot of us. So I
Uh-huh.
think that's what set it apart. Really, is that it was just more focused area of study.
And so how long were you in anesthesia school? Is this pretty similar amount, like 2 to 3 years, as it would be for nursing school, or shorter time window for it?
How long did I work as a nurse?
Or
Is that what you asked?
how long did it take in the anesthesia program to graduate from that? Like how long does that program last?
Oh, sure. So the
Mhm.
anesthesia program, when I went through, It was a 27-month program. So we started in August and we finished up December 2 years later. Now it was a master's program at that time. And I think in 2022, all nurse anesthetist programs are going to be doctorate degrees, or
Oh, wow.
so you're going to get doctorate of nurse anesthesia. They call it a DNAP or a DNP program. And so they're going to be about 33 months. And they're going to be a little more expensive. So, but that's where the profession is going. And so you're going to come out with a doctorate in nurse anesthesia now.
And so how will that play in the difference between a nurse anesthesia, I keep messing up the word, versus an anesthesiologist? Like if you have these people getting doctorate degrees, is there going to see kind of a role change a little bit, or where do you see that going?
No, so the reason they went to doctorate degrees is you'll be able to teach, you can manage, or you can teach, manage. One other component. There's an education component, a management component, and oh man, there's a third component. I just can't think of it right now. Sorry. I might think of it in a moment. But anyway, it allows the CRNA to teach in the academic setting, allows them to manage a program, a CRNA program, to be a manager of that, or to be like a manager of a group. And the administrative aspect, that's what it was. So you can get 3 different areas of study within that doctorate degree: administrative, education, or management. And so those focuses are kind of let you decide what you want to do with that doctorate degree. And so, you can still be a nurse anesthetist, just a regular old clinical, go to the OR, sit on the anesthetic chair and provide anesthesia. You can still do that as well. But you've got those focuses built into the program if you want to pursue that later on. A lot of people I know that they get the education and then they teach at a community college, and they'll teach some sort of class. It can be pharmacology or anatomy or something. They may teach a lesson or two on different topics to nursing students or anything really. So that's there for you.
Gotcha.
So, and to answer your question, will it change anything between the relationship of anesthesiologist, nurse anesthetist? No, it won't. It's just your degree, and it's just you're meeting the new standard that the accreditation programs and entities have set for nurse anesthetists. So that it won't change anything from that relationship.
So in like the whole hospital, is the nurse anesthetist, is it just kind of in its own separate category from the other nurses in the ICU or 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 whatever, or what does that look like from an organizational structure? Does everyone report to one?
It doesn't really. Yeah, no, we still fall under the nursing umbrella within a hospital setting. And so it doesn't really affect anything. We are sort of a specialty within nurse anesthesia, within nursing, but there are a lot of specialties within nursing, honestly. So we're just one of those subset specialties. We probably make the most in terms of salary within the nursing specialty. CRNAs generally are paid more than most other specialties by quite a bit. And so, but you'll find salary varies, wherever you're at across the country. So, but usually salary compensation is in the top tier when it comes to nursing specialties.
Gotcha. So from your time just working in the medical industry, what have you seen personally and with other people as the most important skills that someone has to have if this is what they want to pursue career-wise?
So career-wise, it's probably it's probably the same as with a lot of careers. You really need to be dedicated if you're going to succeed. It's not something you just want to kind of wake up one day and think, yeah, I want to do this.
Right.
No, you're going to need some dedication and some discipline, and it's not necessarily about your intelligence. It's about how hard you want to work to achieve this. So, like I said, I didn't have the greatest GPA when I went into nursing school, or when I got out of nursing school. I didn't have the greatest GPA, but I did have a desire and a determination to go to anesthesia school, and so that's what I did, because it requires some studying and some sacrifice, and you're going to miss some things
Right.
while you're in school, but it's well worth it once you come out. So, but yeah, and that's probably true with a lot of things. Is you got to make up your mind and have some support with family and friends and that sort of thing, and stick to it. It's not something you want to waffle on or
Right.
decide maybe later, if this doesn't work out, I'll do something else, because it's the financial commitment for sure.
Definitely. So how have you really seen your role change in this, pandemic that we're going through, or has it really changed as much? Is there less people going to hospitals? What have you really seen?
So our role as nurse anesthetist, it hasn't changed just a ton, but I do ask, I get asked quite a bit, what are you seeing at the hospital, and how are y'all doing things differently, and that sort of thing, and we constantly wash our hands in the hospital. We're always wearing masks in the OR, so a lot of that hasn't changed.
Mhm.
But how we manage patients in the OR has changed.
Mhm.
We just have to be more meticulous about airway management, because since we're in the vicinity of the patient's airway, and that's how the virus is transmitted, is so we're going to be in close proximity to that vector, and we want to be as protected as we possibly can. So we're in N95 masks, all the PPE, and just trying to minimize that exposure as much as we can.
Uh,
There have been a few things we've done, but for the most part, it hasn't affected us too
do
terribly
you
much.
think there will be any major changes that come out of this situation for the medical industry? Do you think there's probably more people that are going to want to go into the medical industry, or new standards that are going to come from this? What do you think about that?
I think we'll see some changes come out of it, but by and large, I think when you go into the healthcare field, you're exposed to a lot of things that can be
Uh,
pretty dangerous.
mhm.
Um, you can be exposed to tuberculosis, HIV, Ebola. I mean, you really never know what you could be exposed to. And so this is just another one of those things you could be exposed to. And I remember when I worked in the ER just starting out, it seemed like I was sick all the time. I mean, I had, and that's just my immune system was getting built up because I was coming in contact with a lot of sick people all the time. And
Mhm.
that's just anybody that works in the ER will tell you the same thing.
Mhm.
And so you do get exposed to a lot of it, and that's kind of what comes with the territory. And so that's why we wear gloves and masks, and take the precautions that we take.
Uh,
But so I don't know that you can really you know minimize all those exposure variables, but I'm sure there will be some. And really it comes down to washing your hands and covering your mouth when you're coughing. That's probably the two simplest things you can do to minimize viral transmission.
uh,
And I think just consistently using some sort of hand sanitizer and washing the common surfaces that you touch, and that sort of thing. So just being more intentional about cleanliness, and not trying to transmit uh, viruses on the things that you touch. So if anything, that's going to be just more of an awareness, professional awareness about how that can be done.
mhm.
So, but right now, we have patients in the hospital right now today that are COVID positive, and so we just take those precautions as best we can. I think they're learning as much as they can about this, and they're going to push all that information forward as they find out about how best to protect yourself and others. And so until they kind of know the full understanding of what they're actually dealing with, we're just kind of taking all precautions within reason.
Right. No, makes a lot of sense. Well, again, thank you, frontline worker in this, and being in the medical industry. I know it's obviously really difficult right now and stressful for everybody involved. So thank you for that. What is, barring maybe a pandemic, the shifts? How does that really work? Because obviously you have people who are there 24/7. So what does your shift look like? How do they determine if you're there during the day or at night, or is there a call-in process at certain times? What does that look like?
Sure. So we start our day typically around 7 a.m.
Uh-huh.
And then we work 8-hour shifts, 10-hour shifts, 12-hour shifts. On the OB floor, we have a dedicated OB CRNA, and he works either a 12-hour shift or a 24-hour shift in-house. And
Oh,
so he may not be on his feet the entire time,
mhm,
24 hours, but then again, he may be pretty busy. So yeah, that's just OB. And so, um, but generally speaking, if you're just up in the OR, you're doing some sort of shift work.
mhm,
And fortunately, these doctors, surgeons, they can't work 24 hours, and so we don't have to work 24 hours. So
mhm,
we just work typically 8-hour shifts, 10-hour shifts, and a 12-hour shift.
mhm,
And then we will take call where I work. We take call, and so the OR schedule is done for the day, we all go home,
mhm,
and then if anything comes in emergency wise during the night, we'll go back and take care of that. And so
mhm.
we're on call until the next morning at 7 a.m. And then after we take a call shift like that, we're usually off the day afterwards.
Okay, gotcha.
So, and that's generally how it is
Mhm,
most places. You have some sort of shift work, and where you have a call obligation that's generally 24 hours,
mhm.
and you're off the day after call.
So
So
how do they determine who is on call at this certain day, or is it just everyone's on call? The first one who can make it there is the one who answers, or there's shifts for you're on call this set of days and so on?
so we have two people that are on call
Mhm.
every day, and then the OB person is on call. So technically, there's three people,
Three people. Wow.
and we have an OR, anesthesia chief CRNA
Mhm.
is what is his position, and he makes out the schedule a month or two in advance, and he just kind of divides the call obligations up amongst us so it's fairly even. Sometimes you want to request not to be on call a certain day, or you want to
Mhm.
request to be on call a certain day. For example, if I was on call Thursday, well, I'd be off Friday and Saturday and Sunday, so
Mhm.
that would work out nice. So you can request things like that.
Mhm.
But yeah, we have two people that we have a first call, a second call obligation, and then a an OB call obligation.
Mhm.
So that's probably fairly standard at most places. You may have people that take uh, you know, cardiac surgery call or some sort of other call obligation.
Mhm.
Um, but in general, I think that's probably pretty standard that there's 2 to 3 people on call per facility
Right.
for anesthesia.
Uh-huh. And so how much have you really seen anesthesia change since started working as a nurse anesthetist? Has it just the technology is completely different than it was 10 years ago? Do you see it being completely different in 10 years? Is there a lot of similarities to what it's like?
So the day-to-day stuff, I mean, you still do the same thing day
Mhm.
to day. That aspect hasn't really changed. The charting has changed. There's a lot of computer charting that we now do. Um, and then we have all kinds of gadgets and gizmos for airway management. That has changed.
Right.
Um, and there's been some new medications come
Mhm.
online that the FDA has recently approved, and that has changed. And so we're seeing changes. That's just medicine, and that's just life in general. You're going to see things change in probably any specialty,
Right.
but overall, it hasn't changed that much.
Mhm.
Um, so you still generally put people to sleep with a medicine called propofol, and
Mhm.
keep them asleep with an anesthetic gas, and that that recipe has been the same for quite some time.
Mhm.
They came out with propofol in the late 80s, and it's been probably the most common anesthetic medication that we give. You may have heard referred to as the Michael Jackson juice because Michael Jackson killed himself with it. And
Uh-huh.
so propofol or Diprovan, and yeah, it's used in every OR across the country.
Mhm.
Um, And so we give that, we give paralytic medications and pain medications and anesthetic gas. And so that aspect, it hasn't changed. But what they do to patients, the procedures that they do, that has changed quite a bit. Robotic surgeries, in orthopedics, general surgeries. Um, we do lots of procedures that we used to do. Some of them we don't do them anymore because they've fallen out of favor, or there's just a new way of doing it altogether.
Right.
So
Well, I don't want to
yeah,
take.
it's constantly changing.
Yeah, no, I mean, that's definitely something that, from speaking to other medical people, just the day-to-day task managing has been one of the big things they've noticed that's totally different. So, to not take up too much of your time, obviously, I know you're busy, this is your day off. Uh, if you could look back to your 18-year-old self, the high school senior self who said, didn't know what he wanted to do, if he wanted to go in the medical industry or not, and give him a token line of Dan Snow advice, what would that be from all your years of experience that you've gleaned so far?
What
I
would
know.
that be if I could look back? Oh wow, yeah,
Uh-huh.
that's a good one. So yeah, I think that's a song, man. What a Toby Keith song, and that
Yeah.
a Toby Keith song? If I knew now what I knew then, or something like
Uh-huh.
that. Yep. No, I would. Geez, that's a good question. I think I would probably. Probably a few things I would want to do. I would really want to. I think I would probably stay in medicine. I really enjoy medicine.
Mhm.
Um, and it's not that. One thing I may do. Uh, I would probably don't tell my wife, okay? But I probably would not have gotten married as soon as I did.
Uh-huh.
Um, and it's not that it's not my wife or anything like that. It just did create a little more financial hardship in the beginning, getting
Yeah.
married as soon as I did.
Uh-huh.
Um, so that would be one thing. Another thing is you know, be careful about the people you hang around with because they really have more influence on you than you realize.
Mhm.
And if I had been able to tell myself that, I probably could have saved myself a lot of time and money.
Yeah.
And so you know those people that you're hanging around right now really have a profound impact on you, and you don't see it until you're on down the road. And so but there's an old saying, show me your friends and I'll show you your future. And so if you're hanging around people who aren't going anywhere, odds are you're not going to go anywhere either.
Yeah.
And so you need to be around people that are going to challenge you and push you, and who are like-minded and who are focused, because you're going to feed off that. So those are probably two big things is if you can wait to get married and start a family, then and get your education
Uh-huh.
done, um, you'll be better off, generally speaking.
Mhm.
Um, be very aware about the people you're hanging around, because they do have a profound impact on you.
Well, once
That's
again,
probably what I tell myself.
right, exactly. Once again, thank you very much. We really appreciate you, all medical professionals. Thank you for taking the time out of your day to come on the show. To all our listeners and viewers out there, make sure you're following us on social media at The Ride Along. We'll have more episodes obviously coming out. Once again, make sure you guys are supporting your medical professionals as many ways as possible. Thank you again for coming on the show, guys. Tune in next time, please.